What would you do when you cut your finger or fell and injured your skin? After cleaning the dirt and blood, what do you do? Surely, most of us will put a plaster to prevent further bleeding and let the wound heal. But I'm sure that most of us are unaware that this bleeding also possibly occurs in our heart, and similar plaster concept can be applied on sealing the bleeding. Yes, I'm a biomedical engineer currently developing a thin polymer membrane as a plaster to seal and stop the bleeding from heart. Now, you may wonder why a heart needs a plaster. How can it bleed when it's already covered with blood? Allow me to clear your doubts. We are familiar with patients undergoing open heart surgery due to severe heart problems. This means that to operate, their chest is cut open for a direct contact on the heart to treat the disease. Now bear with me, it already sounds terrifying, but what makes it worse is the complications followed by the surgery. Would you believe me if I say that there are some cases where the patients are rushed back to the operation theatre again after the surgery due to the bleeding complications from the heart? The bleeding happens, well, not because of the heartbreak obviously, but because of the leaking of the blood from the sachet region during the closure of the cut after the surgery. It's shocking, and as a Malaysian, I don't think we need this kind of buy one free one offer in such a life-threatening situation. But unfortunately, it happens unexpectedly. So to address this problem, this membrane will be attached on the heart surface as a sealant right after the surgery, as shown here. But we need an agent to stop the bleeding, and for that comes our rescuer called Factor 7. Now be clear, it's called Factor 7, not James Bond 007. But dare I say, both of them have something in common, is that Agent 007 saved our life from terrorism, and this Factor 7 saved our life from bleeding. It's not something new. Factor 7 naturally present in our body and is responsible to stop bleeding. So by attaching this membrane on the heart surface, this membrane seals the sachet region while our very own Agent 007 takes in charge whenever the bleeding happens in our heart, and it's completely safe for our body. So in short, the heart bleeding can be a traumatic experience, but it can be prevented at an early stage by applying this membrane, and the patient can return to their normal life in no time. So why worry much when our very own James Bond is there to save your heart from bleeding? Thank you.